Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Think you've missed too much of the Idaho legislative session to catch up? Not even close. Our Legislative Roundup newsletter is following the biggest budget decisions, key debates, and everything else happening at the State House in one quick read every Monday. It's not too late to stay informed. Subscribe today at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Last week, as so many of you know, tragedy hit the Treasure Valley when Nampa Mayor Rick Hogaboam died unexpectedly. Dr. David Pate, who was the former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak, is joining us today to talk about all things public health, but to also talk more about what caused the mayor's untimely death. Dr. Pate, I want to welcome you back to the show. Good to have you with us again.
Thank you, Gemma.
So, Dr. Pate, the mayor's cause of death, this is according to the Ada County Coroner's Office, and I hope I'm saying this right, was cardiac tamponade. Can you explain what this condition is? Because I think, like a lot of folks, I had never heard of this issue before.
Yes, and I wouldn't expect anybody outside of the medical field to have heard of this condition. Thank God it's reasonably uncommon, rare. But what the condition is that there is a sac that envelops and contains your heart, and that's called the pericardium. So when you hear of somebody getting pericarditis, it's inflammation of that sac around the heart. That's not what this is necessarily. It could be involved. I would need to know more from the autopsy report. But what this specifically is the accumulation of fluid. Could be air, but that not in this case, I can't imagine. But fluid, usually blood, but can be a variety of fluids in the space between the heart and that pericardium or that pericardial sac around it. And so what happens is if it develops slowly over a long period of time, that pericardium, that lining, the sac, has the ability to stretch, and so it can contain more fluid. In cases where this is a chronic condition, I mean, we could see a quart or two of fluid there before it gets life-threatening. But if it's acute, as I suspect in the mayor's case, it could be as little as a half a cup of fluid if it occurs, if it accumulates rapidly there, that the pericardium just doesn't have time to stretch. So what it does is it just basically compresses the heart and doesn't allow it to have your venous blood return to it and fill it, and therefore it can't pump out the heart, or it can't pump out the blood. And so you are not going to survive that. If the only times that in those kind of conditions that I've seen and we've been able to resuscitate is because we're right there and we can stick a needle into that space and drain the fluid. In the mayor's case, if this had just been a routine heart attack or something, he was in the luckiest of circumstances that another mayor was right there who was a firefighter and trained in CPR and could start CPR right away. But with cardiac tamponade, you're not going to save them with CPR. It's got to be getting a needle in there and get that fluid out of there, unfortunately.
So Dr. Pate, are there signs or symptoms that, I mean, I know this is rare, that people, could be looking for, even if, as you said, it could happen quickly?
Yeah. So if it's chronic, if this is a slow, so there's lots of things that can lead to this condition, and we don't know in the mayor's case. I can hazard some guesses, but we just don't know. The most common reason we would see cardiac tamponade would be malignancy, where you have an underlying cancer of the lung or breast, and that actually metastasizes to this pericardial lining, and then the metastasis produces fluid and causes that to accumulate. Even for lung cancer patients and breast cancer patients, this would be a rare complication, but it is one of the most common reasons for us to see this rare condition. Now, from all that I know, at least in the public information, we have no reason to believe that he had underlying health issues, and certainly not an advanced cancer that would be metastatic. So I don't think that was the cause in this case. But you can see it in infections, you can see it in autoimmune diseases, you could see it in trauma. If he had been in a car accident, for example, and compressed his chest, you can see it with a aortic dissection. And sometimes if you have a heart attack that is so severe that it actually causes damage all the way through the heart muscle, you can get a rupture and the fluid actually goes the other way from inside the heart into that pericardial space and then tamponade. But there's lots of reasons it could happen. If it's slow, if it's a really rapid one like the mayor's, you're probably not going to have a lot of symptoms. You might have just immediately before, you might have chest pain, chest pressure, shortness of breath. But generally, this is a pretty fast evolving situation. When it's chronic, yes, you usually to be on the alert because they have the underlying diseases that contribute to this. We'll see this in kidney failure patients, for example, that kind of thing. And you look for you look for, if you're doing an EKG, you look to see, are the EKG waves really small because the electrical activity doesn't get through. If you have one of the chronic cases, sometimes we listen with the stethoscope to see if we can hear a little rubbing sound for the pericardium. We can see people start having problems with their blood pressure, that kind of thing. But when it's acute, there's just really, unless it happens in the hospital, you've got very low chances of surviving, and you're usually not going to have much notice.
So, Dr. Pate, I mean, if it is something acute like that, you don't have much notice, then I would assume that you wouldn't necessarily maybe even have symptoms that you might recognize or that someone else might recognize and say, hey, let's get you to the emergency room.
That's right. It's possible that, my understanding is he was giving a speech. It could have been maybe right at the beginning, if he started complaining that he was having chest pain, shortness of breath, lightheadedness. Those are the symptoms that we might have gotten a clue to, but it would have occurred very shortly before. My understanding, and of course I don't have all the facts, but my understanding is that he did not realize that he was unwell, and no one around him realized until he was giving the speech and started slurring his words. And probably that was the initial manifestation, because when there is tamponade and the heart can't pump out the blood and you're standing up, which presumably he was, the first place that's going to feel it is your brain. And so what happened is he started slurring his words, from the public reporting that I've seen, which was probably the very first sign. And it was while he was already giving the speech. So there was just really almost no hope. It's just such a tragic case, because he was young. He was in his first term being mayor, apparently quite popular, and has a family. So all of this, especially when the family's almost certain to have not had any idea that he would be at risk for any kind of serious problem, and here he has this sudden death, which you just don't expect in a healthy 7-year-old man.
Yeah, it is just tragic. Dr. Pate, appreciate you walking us through this and everything. And really our thoughts go out to the mayor and to his family and to everyone in the city of Nampa. And just if people are wondering, there is going to be a public memorial service for the mayor. That'll be on March 31st. And it will be at the Nampa Fort Idaho Center. It is open to the public because I know there are so many people who want to show up for the family and show their respect as well. Dr. Pate, we need to get on to other public health news. And I want to talk next about this meningococcal outbreak that's happening in the UK right now. So let's kind of start with the basics. Can you explain what meningococcal disease actually is and how it's different from more common types of meningitis that people may have heard about?
Yes. So this outbreak that is occurring in the UK is with a bacteria that is called Neisseria meningitidis. This is when you think about, and you and I discussed that RFK Jr. had eliminated the recommendation for, you remember when our vaccines that are recommended went from 17 to 11. Well, one of those recommendations that was axed was for the meningococcal vaccine. That's the vaccine to protect against this bacteria. And the reason, although this is not the most common reason for meningitis, it's not the most common type of infection we see, why this is so concerning and so alarming. In fact, I am just waiting for our first outbreak here in the United States of this year because I can almost guarantee it's coming, is that although less common, this is an infection that tends to affect young people, high school and college. Particularly, especially we think about it in colleges because students are in dorms together. They start, they're living closely together. They're eating closely together. They often are in romantic relationships, et cetera. So it is the perfect environment for this bacteria to spread. That's not the only setting that we see it. But the thing about this one, which is so why it's so scary to me, is that, first of all, if you get this infection, you can deteriorate over hours. Just in a matter of hours, you can go from walking to dead. This has a mortality rate that generally rates between around 10 to 15% of people that get this infection will die. Unfortunately, here in the United States, it's not the same strain that is currently breaking out in the UK, but what we've seen since late 22, early 23 is a new variant, a new mutation in the strain that is more common in the United States that it tends to affect even older adults, those after age 30, and it's coming in with about an 18% mortality rate. So it is concerning. It's a consequence of people not being vaccinated, and that's why I am quite confident we're going to see it. My guess is we'll see it in a Florida university is probably where it'll first show up. But for parents, once your kids turn 11 or 12, that's about the time to start getting them vaccinated and a booster before they go off to college.
Okay, I want to talk a little bit about that a little bit more because, as you mentioned, this outbreak is actually happening among university students in England right now. And for parents who are listening, right, and we've got teenagers or college students, I have a kiddo that's going to go off to college in the fall, Dr. Payton, as you said, get them that booster before they go off to college. I know our pediatrician said, and I believe my son is already fully vaccinated, but there's a third booster he can get before he goes off to college. And we are planning on doing that with him. So is that something the parents, should be doing? Contact your pediatrician, make sure that those meningococcal vaccines are up to date, in particular before our kiddos head off to college in the fall.
Absolutely. I did that for both of my daughters before they went off to college. And it's a very safe vaccine. It's very effective. The problem is you just don't get real long lasting protection, but that's why we give the booster, and you can certainly get a good a boost for a couple of years. We typically tend to see this with kind of the first year students when they get to colleges and dorm living and so forth. So that is a very, very important thing to do. Not because this is real common, but boy, that is the setting to get it if you're going to get it. And it is literally the person can go from being fine this morning to dead this afternoon if they're not
All
getting
right.
attention. So,
Dr. Pate, Pfizer is working on a new vaccine for Lyme disease, and my understanding is it showed about a 70% effectiveness rate in trials. So, from a medical and public health perspective, is that considered strong protection for a vaccine like this?
it is very much considered strong protection. We have not had a really good option for protecting against this disease. And this is not a disease that everybody in the United States would need to get vaccinated for. But what would be great is to have this vaccine for those people that live in the high risk areas where this tick it carries the disease. Because when people get infected, if they don't get treated, if it's not recognized and treated satisfactorily, some patients will go on to develop very long-term, even lifetime consequences and some disabilities because it can cause neurologic, cardiac, and joint problems. And so, yes, it would be great to have an option, not necessarily to require it for people, but people that live in those areas are going to travel to those areas.
Dr. Pate, researchers say the one thing they're concerned about, though, is that people might see a Lyme disease vaccine kind of as a cure-all, right? So it's like, oh, we don't need to worry about ticks or anything like that anymore, and stop taking precautions. Again, even if a vaccine becomes available, I would think it would still make sense, right, to take prevention steps. Should people still be doing that even if this vaccine becomes available?
Well, yes. I don't go around sticking myself with rusty nails, just assuming, hey, I'm not going to get tetanus.
Right.
So obviously, with vaccines, we still need to exercise some caution, and their concern particularly centers around the fact that people might think this is the only disease you might get from ticks, but that's not true.
Mm.
It's the most common in the United States, but there are even some far worse tick-borne diseases, particularly in the northeastern part of the United States, that you can get that are quite serious. So everybody should exercise caution to ticks and not be complacent about this no matter what.
So, Dr. Pate, I want to move on to this other study. This is a new long-term study out, and it suggests that people who follow what's called the MIND diet, and this emphasizes foods like leafy greens, berries, fish, olive oil, may actually have brains that appear about 2.5 years younger on MRI scans. So, can you explain what exactly the MIND diet is, and why might these foods be, more protective for our brains?
Yeah. So the our brain health, what we are learning is that it's multifactorial. Your diet contributes, your weight contributes, your infection history contributes. And what we are consistently and increasingly learning is that it's neuroinflammation that is likely contributing to brain aging and neurodegenerative disorders. And so the idea is if we can reduce levels of inflammation, then we can preserve brain health and functioning. And so this MIND diet, just as you mentioned, it's an emphasis on foods that have anti-inflammatory properties, or at least don't contribute to inflammation. For example, we have known for some time that red meat, dairy products, they can a lot of high sugar and candy and those kind of things. They can contribute to increased inflammation. And so this diet emphasizes leafy greens, berries, fish, poultry, olive oil, and on the other hand, tries to limit fried foods and red meats and sweets that we know contribute to inflammation. And so, just as you said, they followed these people for a long time, looked at their MRI scans, because we can see how is the volume of your brain holding up? Because with age, it tends to shrink a bit. And we can look to see if the gray matter, you have gray matter and white matter in your brain. We look at the gray matter because that's where your memory and executive thinking, thought, higher level thinking occurs, to see if that's preserved. And what they said, just as you said, those people that followed the diet most closely, their brains appeared to be 2.5 years younger than people the same age that didn't follow the diet closely. So that exercise, alcohol, keeping alcohol as low as possible, those are all things that have also been shown to contribute positively.
Well, and Dr. Pate, the study found also that the people who followed this diet the most closely, they had slower shrinkage in the parts of their brain, as you said, like right in those memory and thinking areas. So what does that say, or I guess what can we learn from how significant that could possibly or potentially be when we're talking about trying to reduce the risk of dementia or potentially, Alzheimer's disease? Or does that factor into this at all?
Well, it does, because we've also done studies. For example, we did studies through COVID, because we've known for a while that infections can cause inflammation in the brain. We've identified with Epstein-Barr virus that it can actually contribute to developing multiple sclerosis. We've identified another virus, the human pegavirus, that can contribute to getting Parkinson's disease. And now we believe that we're getting mounting evidence that infections like COVID, and then you and I talked about the protective effect of some vaccines, like the shingles vaccine and so forth, flu vaccines, that reducing infections can lead to less brain inflammation, because we think it's that brain inflammation that can then lead to dementia and some of these neurodegenerative conditions, as well as other factors. And like I said, we used to think a moderate amount of alcohol was good for your brain. It's looking like that's probably wrong, and probably there's no amount of alcohol that's good for your brain. But we also noticed that people that exercise frequently tend to have better preserved brain function, especially if you exercise physically and mentally. So all of these things are part of good health. And the key to this kind of a finding is to talk to people that are middle-aged, people that are sitting there with office jobs, working so hard, and then they have kids at home, so they get home, they're exhausted, and they want to get fast food, or they don't have time to exercise themselves, that we need to explain, hey, these things are important now, so that when you're my age, you are going to have the best brain health possible.
Yeah, that's really good advice. Appreciate you, Dr. Pate. We've been talking with Dr. David Pate, former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak. And remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed, because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. And if this episode meant something to you, text it to a friend.